Go.
Hi, I'm Ashley and this is my presentation on the roles and responsibilities of the healthcare professional, more specifically the nurse. So firstly I'll be looking at changes, and the changes occur usually due to social, economic, political, technological or scientific developments. An example of a political change which impacted the role of the nurse could be the introduction of the 1948 NHS Act itself. The formation of the NHS meant that care became more patient-centred and therefore patient autonomy was encouraged. This impacted the nurse's role as their accountability as it increased, and the methods of treatment are centred more around improving the mental health via counselling, etc., rather than jumping to give medication. Another example of a political change could be the Patients' Charter in the 1990s, which was brought in to make healthcare workers and nurses more accountable for their actions. Because the NHS is supported by public funding and require the government responses to control supply and demand, there is high likelihood that the system will be at risk of demand inflation over time. As pointed out by Harrison and McDonald in 2008, due to the ageing population, heightened public expectations, more expensive treatments, the unemployed and the retired, public expenditure must be properly controlled to keep on top of rising costs. Usually these economic changes and increases in funding are beneficial to the public, however some changes may not be. For example, the Mail on Sunday, September 4th reported that smokers and obese people may be refused surgical treatment if the condition isn't life-threatening for up to a year, due to the cutting of hospital costs. This was branded as an abuse of human rights, and these changes to funding may impact nurses as it could lead to lower salaries or wages which do not level with inflation. As trade unions influence contracts and pay, this can be detrimental to the NHS professionals and patient care, as it can result in strikes, which has already happened as the junior doctors called for a strike, and this meant many treatments were cancelled and senior doctors were overworked. Social changes in healthcare come as a result of the increasing demand on services and funding. People are living longer and the cost of caring for the vulnerable, chronically ill and the elderly is on the rise. As Salvage said, healthcare is a social responsibility and nursing must adapt to the changing patterns of care. This has been achieved as the nursing career has been expanded greatly in terms of responsibility, expertise, skill and career progression opportunities. Harrison and McDonald suggested that as healthcare professionals are now expected to adhere to clinical protocols, codes of conduct and guidelines, this has made medical information more accessible to patients and therefore they're in a better position to question their treatments and decisions made. Again, this increases nurses' accountability. Technological changes such as new methods of non-invasive surgery, such as keyhole surgery, new diagnostic equipment, investigative screening procedures and genetic technology have enabled the NHS to anticipate illness/disease earlier on and intervene quicker, so the opportunities to improve patient health has increased. Another result of technological advancements is that the information is much more easily accessible for the patient, and therefore their expectations are higher than ever. This puts more pressure on the nurses to perform their job roles well and increase their accountability, and it also means that additional training must be undertaken to understand the newer technology or the equipment introduced, and this means nurses are having to expand their roles and responsibilities further. An organisational change which massively impacted healthcare was the Francis Report 2013, which reported a number of risks to patient safety and introduced changes to improve staff practices and promote better safety. As the healthcare environment is high pressure, this invites more chances for human error, and therefore this act seeks to anticipate potential safety problems and prevent them. This impacted nurses as they had to alter their habits and methods of work in order to adapt to this new model of better communication and strong leadership. So there are a number of very influential women who massively contributed towards the NHS and our high standards of healthcare today. Women are possibly more integral to healthcare than history shows, as it was predominantly recorded by males in a biased era, and that contribution that women made has been possibly forgotten, so this could have hindered the progression of the NHS and healthcare today. So there is also evidence to show that in ancient Egypt there were female midwives who probably weren't properly trained officially, but were trained by experience. An influential woman in healthcare could be Elizabeth Garrett Anderson, and she was the first female woman to qualify as a physician and surgeon in 1865. She was also the only female member of the British Medical Association and the first female dean of a medical school, and it could be argued that her impressive steps into a previously male-dominated field paved the way for all female medical professionals today. As women were expected to be the caregivers for their families, the role of nurses was appointed initially as just a less medical caregiving job role, and it also was given to women of a lower stature with questionable morals and responsibilities. So Florence Nightingale's influence actually revolutionised nursing completely. She influenced the way it was taught and exactly what a nurse should be. Her fight for evidence-based learning and compassionate nurses is something that's carried over into today's nurse, and that's why she is one of the most influential women in healthcare history. She also wrote over 200 reports, books and pamphlets, and was an advocate for prevention over cure. Another influential woman in healthcare was Ethel Bedford Fenwick, who led the campaign to reclaim professional standing for nurses. Fenwick's movement helped, although the Nurse Registration Act wasn't brought back until 1919, as previously physicians and surgeons had controlled nursing. So nursing was impacted by role expansion in the following ways. The establishment of the Modernisation Agency meant skill and role expansion. The opportunity to become a clinical specialist nurse. More opportunities became available for nurses in the forms of roles such as emergency care practitioners to help cope with the demand under A&E. Patient autonomy increase meant that nurses had the chance to expand their skill set and work with the patient to determine the best way to proceed. More opportunities became available for nurses as more responsibility equals more accountability, and the nurses spending less time with the patients due to the nursing teams becoming more varied with different specialists and levels of qualification. So I have created a flowchart here just to show how nurses can progress under the structural developments. As well, the career training and education opportunity for nurses has grown massively over the last few years. So there are a number of professional bodies in healthcare. For example, you have the Professional Standards Authority for Health and Social Care and the Regulators of Health help to regulate public health, promote fitness and maintain public safety and proper conduct. You've got the Health and Care Professions Council, the HCPC, which helps to regulate health for social and psychological professionals. The Nursing and Midwifery Council as well protects the public by setting standards for education, training and conduct for nurses and midwives. They go by a code of professional standards in practice and behaviour. I have listed the main principles here, which are keeping an up-to-date register of healthcare professionals, investigate when standards are not met to maintain accountability, to set the guiding standards for education, training and codes of conduct, and regulate and support healthcare professionals to administer high-quality care. An example of how the NMC acts as a source of guidance support for nurses in the workplace is that they offer professionals advice on how to conform to the patient autonomy and consent rules in line with the Mental Capacity Act 2006. The NMC's list of standards of practice and behaviour is extensive and detailed. The first of 24 sections, for example, is prioritise people, put people first and prioritise their safety and dignity, which is then split into 5 subsections guiding staff on how to fulfil this standard of care. For example, treating people with kindness and respect and upholding their human rights. This should demonstrate the level of support they offer the staff in terms of guiding them to be the best healthcare professional possible, and also the height to which they set their standards and how important they are in terms of ensuring the NHS delivers the best possible care. Whistleblowing is very important, and the professional bodies help to enable this, as well as the trade unions. They shine light on negligence or abuse which has gone unnoticed by authorities. It's important that staff feel they have a reliable place to report such situations in order to protect patients from mistreatment. The ability to whistleblow freely, as made possible in the Public Interest Disclosure Act in 1998, means that issues may be reported quicker, and this will stop them progressing any further and becoming a scandal, which is what happened in the 2009 Panorama programme, where the undercover investigations exposed serious failings of caregivers and the system for home care providers. This demonstrates how important it is for both the reputation of the NHS and healthcare professionals, as well as for the well-being of the patient and their confidence in our system, that professional bodies and the ability to whistleblowing are. The professional bodies also offer advice to professionals in grey areas, such as informed consent issues. For example, this can be tricky when the patient is incapable of giving their consent and there is no next of kin or relatives to make choices for them. The NMC offer advice in line with the Mental Capacity Act of 2005 for healthcare professionals to access in such situations. This protects the staff and the patient. So professional bodies also offer advice to professionals in grey areas, such as informed consent issues, promote public safety using risk assessments, regular clinical audit and enabling professional development, and investigate allegations against nurses and midwives, and they hold the power to suspend or end their practice. So next I'll be discussing the multidisciplinary approach in healthcare. The multidisciplinary team includes a wide range of different healthcare professionals and clinicians. In specialist healthcare, there are many examples of the multidisciplinary team, such as for cancer patients, diabetics or stroke patients. There are many advantages and disadvantages to this approach, as shown here. So the positives here include decisions regarding treatments are based on multiple opinions instead of just one. It's easier to achieve continuity of care and therefore patient confidence. Clinical management protocols become part of regular practice. There are more communication opportunities between different clinicians and professionals. Professional knowledge and expertise is more shared. An enhanced system of partnership between all involved means management of clinical errors or complaints will improve, and more efficient resource management, whereas the limitations include the fact that shared goals may overtake individual professional goals. The high team turnover can impact the patient experience in a negative way. The traditional power bases are weaker, particularly when it comes to acquiring resources. There is less time for reflective management, such as team meetings. Having too many individuals on the team can lead to time wasting / inefficient communication, and there's less time for team building / development, which may also be unfeasible with such large teams. So to conclude, the multidisciplinary approach is effective in many ways because it pools the skills, knowledge and resources of a multitude of professionals and clinicians, which can stop people with complex conditions, allow people with complex conditions to receive the best care possible and the best possible range of treatment as well. It also integrates health with social care, allowing the team to address different situations and protect the public, and it's a gateway for multidisciplinary case conferences which allow the professionals to agree on a structured approach to a case. However, there is still a chance that a multidisciplinary team could be counterproductive in terms of a positive patient experience, as a multitude of different professionals can confuse the patient. Therefore, perhaps improvements could be made in terms of improving communication, especially with the patient, to avoid confusion and reinforce the patient's confidence in the care that they receive. Another major benefit to having a multidisciplinary team system is the opportunity for case conferences, which do combat the main communication criticisms and get the entire team on the same page in terms of how best to proceed with the patient, the end goal and how they're going to achieve it in the patient's best interests. These case conference functions include examining the issue, discussing the history of the patient, identify the risks and the safest next steps, evaluate previous methods and their effectiveness, allocate tasks to different team members, identify the goal objective and discuss the best way to proceed to protect the patients in cases of abuse. For these case conferences, such as case conferences in child protection, the multidisciplinary teams may include frontline officers, school nurses and social workers, as well as a variety of healthcare professionals. During these case conferences, they take other things into account, such as what course of action is going to keep their child out of harm's way, or is it safe to contact certain family members about the plans for the child, and so on. Overall, it's clear that while it can be argued that the multidisciplinary teams can hinder communication and risk confusing the patient, overall it's an effective way of organising clinical care pathways and the care plans for the patients, and it allows our healthcare professionals to work more cohesively and pool their skills for the best patient outcome possible. So in conclusion, I have explained the role of the nurse and how it has progressed over the years. I've explained how recent changes in healthcare have impacted the nursing role, the function and the role of professional bodies, and the effectiveness of the multidisciplinary team system and its pros and cons. Thank you very much for listening.